The hospital staff knew Harold Martinez as the quiet-night janitor who'd worked at Metro General for 5 years. They knew his daughter Sarah was their star trauma surgeon. What they didn't know was why Harold sometimes winced when he heard medical terminology, why his hands never shook around blood, and why he always seemed to know exactly which supplies the doctors needed before they asked. Harold pushed his cleaning cart down Metro General's surgical wing, moving with careful precision. At 62, his gray uniform was always pressed, supplies perfectly organized. Most staff barely noticed him, but he completed his work with thoroughness that impressed supervisors. Through the observation window of or 3, he caught a glimpse of his daughter Sarah, her hands moving with surgical precision. Pride swelled in his chest every time he watched her work. Dr. Sarah Martinez was everything he'd hoped she would become: skilled, compassionate, respected by peers, everything he'd once been before his world changed. "Harold, you missed a spot," called Dr. Peterson, pointing to a small stain on the floor outside or 2. His tone was dismissive, the way people often spoke to those they consider beneath their notice. "I'll get that right away, Doctor," Harold replied evenly, though something flickered in his eyes that Dr. Peterson was too distracted to notice. As Harold cleaned the stain, surgical prep solution, he identified from its color and consistency. He overheard 2 residents discussing a complex case. "Patients presenting with internal bleeding, but we can't locate the source," the first resident said. Dr. Chin's thinking exploratory surgery. "Could be a delayed rupture," the second suggested. "Sometimes takes hours to manifest after trauma." Harold paused in his cleaning, his trained ear picking up details that most janitors wouldn't understand. Based on their description, he suspected a specific type of injury he'd seen countless times in field hospitals. But he said nothing, just continued mopping while the residents walked away, unaware that they'd just received free diagnostic insight from the janitor. Harold was restocking supplies when Sarah emerged from surgery, exhausted, scrub stained from a difficult case. "Hey, Papa," she said softly. "Another long night?" "Always busy here," Harold replied, studying her with the concerned eye of both a father and someone who'd seen too many medical professionals push themselves beyond limits. "You should eat something. When did you become the doctor in this relationship?" Sarah managed a tired smile. If only she knew, Harold thought. As Sarah headed to the cafeteria, Harold noticed Dr. Martinez, no relation despite the shared surname, struggling with a patient's foreline. The young resident was clearly frustrated, having missed the vein twice. "Excuse me, doctor," Harold said quietly. "Sometimes it helps to try a different angle. The vein might be rolling." Dr. Martinez looked up, surprised to receive medical advice from the janitor. But there was something in Harold's voice, calm authority mixed with genuine helpfulness, that made him pause. "Different angle? Try approaching from the lateral side, about 15 degrees. Less likely to go through the vein." The resident hesitated, then tried Harold's suggestion. The force slipped in smoothly on the first attempt. "How did you?" Dr. Martinez began, but Harold was already moving away with his cart, leaving the young doctor to wonder how a janitor knew advanced for techniques. Harold would quietly suggest which sutures worked best for specific wound types. He'd position supplies exactly where surgeons needed them. He'd notice when medications were running low before the nursing staff realized it. Most people attributed it to experience, assuming Harold had simply picked up medical knowledge from years of working around doctors. They had no way of knowing that Harold's experience came from a different source entirely. The crisis began on a quiet Tuesday evening. Sarah was performing routine appendix removal when Harold heard urgent voices from or 3. Equipment alarms sounded. Through the observation window, he saw Sarah's team working frantically. "We're losing him," someone said. "Pressure's dropping fast." Harold assessed the situation. The patient was hemorrhaging, but the team hadn't located the bleeding source. His trained eye immediately recognized retroperitoneal bleeding. Hard to detect, but deadly if missed. He watched Sarah work, noting increasing tension. She was excellent, but trained in civilian medicine. This required specialized field techniques learned where improvisation meant life or death. Harold made a decision that would change everything. He slipped into the prep area, quickly washing his hands with the practiced efficiency of someone who'd done it thousands of times. Without hesitation, he pushed through the doors. "Sarah," he said quietly. The entire surgical team turned in shock. No one entered inactive or without permission, especially not a janitor. "Papa, what are you?" "The bleeding is retroperitoneal," Harold said, his voice carrying a new authority that no one in the room had ever heard from him. "You need to mobilize the colon and check behind the kidney." "Listen to him," Sarah said suddenly. Something in her father's voice, the clinical precision of his words, stopped her protests. "Papa, how do you know that?" Harold was already at the instrument table, his hands automatically selecting the correct tools. "Because I've seen it before. Many times." His movements were fluid, practiced. Without thinking, he began assisting Sarah with the confidence of an experienced surgeon. "Retract here," he instructed, guiding her hands. "Feel for the pulse. The vessel is probably torn just behind the peritoneum." Sarah followed his guidance, her eyes widening as she felt exactly what he described. "There, I can feel it. Good. Now you need to get proximal control before you can repair it. Use a vascular clamp, the small one." The surgical team watched in stunned silence as the hospital janitor directed one of their most skilled surgeons through a complex vascular repair. His hands never wavered, his instructions were precise, and his knowledge was clearly extensive. Within 20 minutes, the bleeding was controlled and the patient stabilized. Harold looked at his daughter, then at the surgical team. There was no going back now. "Field surgery," he said quietly. "Army Medical Corps, 1982 to 2003. 2 tours in the Gulf War, 3 in Afghanistan. I was a trauma surgeon before becoming a janitor." The revelation hit like a physical force. Dr. Adams stepped forward, irritation replaced by respect. "You're a surgeon?" "Was," Harold corrected. "Lost my license in 2004. Malpractice suit after a patient died. Case was dismissed, but took 3 years. By then, my practice was gone and Sarah was starting medical school. I took the first job I could find to support her education." Sarah stared, pieces of her childhood suddenly making sense. His encouragement of her medical interest, his help with homework. The medical textbooks he claimed were just interesting reading. "Why didn't you tell me?" she whispered. Harold's eyes filled with the weight of years of silence. "Because you became everything I couldn't be anymore. You became the doctor I'd hoped to be. Why burden you with my failures?" "Failures?" Dr. Adams interjected. "Sir, what you just did, that was masterful surgery under pressure. You saved that boy's life." "We saved his life," Harold corrected, looking at Sarah. "I just remembered some old skills." 2 days later, Chief of Staff Dr. Morrison called Harold to her office. "Mr. Martinez, I've reviewed your military records. Your service is impressive. I've also spoken with the medical board about your 2004 case. The complaint was proven fraudulent. Your license was suspended pending investigation, but never formally revoked." Harold's eyes widened. "What does that mean?" "With paperwork and recertification, you could practice again. This hospital would be honored to have you back in medicine." The offer hung between them. Harold had spent 5 years convinced his career was over. That evening, he found Sarah in the cafeteria. "My father is more incredible than I thought." She took his hands, surgeon's hands despite years of holding mops. "You didn't fail. You sacrificed your career for mine. You continued serving, just differently." 3 months later, Dr. Harold Martinez returned to surgery. His hands were steady, knowledge enhanced by decades of field experience. The most satisfying moment came during his first case, when Dr. Sarah Martinez assisted him. Father and daughter working together, saving lives that might otherwise be lost. When colleagues asked how it felt to return after years away, Harold always said, "I never really left medicine. I just found different ways to serve."